When we think about our health, our skin can be such an indicator of how we are doing.
Skin cancer. So although it's the most prevalent, fortunately, it's also one of the most preventable. We can only be our best selves and take care of everyone else around us when we're taking care of ourselves.
Hi, everyone. I'm Dr. Shafer, your host of Talks with Dr. Shafer. I'm so glad you're here. I'm a physician, mom, coach, musician, author, publisher, and I am passionate about helping others reclaim their stories and build their most beautiful future. And skincare is a big part of that. Do you remember what skincare was like when we were young? It's changed so much, and it is so important to be on the ball knowing what is going on. Did you know that your skin is the largest organ in your body? That's right. Your skin protects you in many ways, and it deserves your care too. Anti-aging, cell repair, regenerative. There are so many words used to describe skincare and so many options. It's easy to get lost and feel overwhelmed as well as to spend a lot of money on things you not only don't need, some of which may actually be hurting your skin. On the show today, we welcome Dr. Angela Casey to give you the inside scoop on actually taking care of your skin. Dr. Casey is a dermatologist sharing her gorgeous skin secrets and the scoop on skin health. She has also created her own skincare line, which my daughter just loves, called Bright Girl, that is specifically made for preteens and teens, but is great for adults as well. Thank you so much, Dr. Casey, for being here on Talks with Dr. Shafer.
Thank you so much for the opportunity. I am really excited to connect with your community, Dr. Shafer.
When we think about our health, our skin can be such an indicator of how we are doing from day to day and as the years go on. And so I think it's such an important topic for us to be discussing here. And obviously, you have so much to share. I so appreciate you being here. To roll back and figure out why it is you do, what inspired you, one, to go to medical school, to become a doctor, and then to specialize in the field of dermatology?
Well, I think I was always drawn to a career and maybe didn't always know it was medicine, but where I would be helping people, touching people's lives, using my skill set to support them and better them. And as a young person, I didn't know exactly how that looked, but as I navigated through school and learned a little bit more about medicine and also growing up as the daughter of a physician, I saw firsthand the difference that the medical community can make in individuals' lives. And like one quick anecdote that comes to mind. So my dad is an infertility specialist, and I grew up in Louisville, Kentucky, which is a medium to small sized city. But we were at the grocery store one day, and I'm with him, and we're picking up. I remember we were in like the aisle getting cheese. And a woman walks up to him and is like, Dr. Sanfilippo, Dr. Sanfilippo, like, oh my gosh. And she gives him a big hug. And she turns to me and said, without your father's help, we wouldn't have our two children. He helped us. We had this infertility struggle and he helped us. And I think at the time I was probably 11 or 12 years old, but that moment made a big, big impact on me. And I saw firsthand in a way that I hadn't understood previously what a difference, like because of my father's skills and the group that he worked with, they completely changed this family's life. So how could I do that? How could I make an impact in the world like that? And so that's what drew me to medical school. And as in medical school, as you're going through rotations, I think it's just like picking a college. You end up in that space where you walk into it, you experience it, and you know exactly that is where you're meant to be because you love every aspect of it. You crave it, you think about it, you obsess about it. And that's how dermatology was for me then 20 years ago and still to this day. I live and breathe it. I love going into work every day. I have a great team. And each and every day, we're coming in direct contact with patients and making a difference in their lives, treating their skin cancers, which is what I specialize in. So, something called Mohs surgery, which is microscopically controlled skin cancer surgery. So, taking care of their cancer, surgically removing it, and then doing reconstructive surgery. And it's a really cool feeling at the end of the day that like you come home and you know you've made that difference.
It's so important. And one of the things that we're going to talk about today, it's not only incredibly important to be skilled in performing the procedures, but I know it's really important to you as well to make the impact of prevention through education. Talking about things like protecting from the sun, early detection, all of those things. And, I tell my husband is really not great about wearing his sunscreen. That may be a husband thing. I don't know, but he's really not great about it. And he has this beautiful nose. And I always just tell him, I would really love not to have someone like Dr. Casey have to take off bits of your nose in 10 years, because I think we're headed that direction, sir, if you don't start wearing sunscreen. And I have to say, honestly, because he's never seen it happen, it's not that convincing. It doesn't scare him at all. But I've seen so many people, need a lot of procedural care. It's wonderful that you're able to provide that care, but an ounce of prevention goes so, so, so far. How are you educating people now with what we know now that we didn't know, back in the days of tanning and baby oil on the skin in the sun that was happening when we were teenagers? How are you educating people now to decrease their risks of needing your services in the future?
Well, you are absolutely right. Skin cancer is the most prevalent form of cancer in the US and worldwide. So, skin cancer incidence outnumbers all other cancers when you combine them. So, you take breast, prostate, colon, every type of cancer combined, and skin cancer still outnumbers that. It will affect 1 in 5 Americans by the age of 70. So there's a good chance that you or someone you know will experience skin cancer. So although it's the most prevalent, fortunately, it's also one of the most preventable. And our studies show that up to 90% of skin damage is directly related to ultraviolet exposure, which can be prevented with good, consistent habits. Every day in my office, Dr. Shafer, I have at least one patient that turns to me and says, Dr. Casey, I've been so good. I wear my sunscreen. I wear my hat. I've been doing this for years. Why am I still getting these skin cancers? Like, why do I have this spot on my nose? And I explained to them, this skin cancer didn't start 5 years ago, 10 years ago, even 15 years ago. It started when you were a child and a teenager and you were out playing sports and you were at the pool and playing with your friends. And every time we get a sunburn on our skin, we know that directly correlates with skin cancer risk. Having 5 or more sunburns in our lifetime correlates to a double increased risk of melanoma skin cancer. So these are real statistics. And I think that just underscores that it doesn't take much to plant the seed of that damage that then over time it just keeps growing. I think the best analogy is thinking about oral health and oral hygiene, because everybody can relate to that. So, very few people know that in the earlier part of the 1900s, there was a single dentist named Dr. Alfred Fones who is responsible for starting the oral health movement as we know it today. And he trained his cousin who as a dental hygienist, and together they kind of created this community and trained individuals on how to properly care and clean and brush and floss the teeth. And because of that one person, we've had this tremendous change in our oral health over the past century. Skincare is not so different. When we start those habits at a young age and we're consistent in performing them every day, we can't even fathom the results or what our children's generation might experience with their skin health as they reach our age because they'll have been equipped with all this knowledge, with the proper ingredients and understanding that you and I and any of the parents that are listening just didn't have when we were that age.
Yeah, absolutely. I think it was the first, sign of summer for me to be the hue of a lobster coming fresh out of the pot. That was pretty typical and so harmful. And I can remember, I think it might have been in high school when I first would go to see my dermatologist because I coped with acne. And I would go to see my dermatologist, and Dr. Barbara Sturm, love her so much. She had these big posters in her office of sunburns, and it was talking about the skin damage. And I want to say at the time, the quoted percentage was 80% of your skin damage was done, before your adulthood. And
Mhm.
it made such an impact. And I felt so kind of stuck because, oh no, it's already passed. I've already had all those sunburns, and I felt really concerned. And so I've always been really meticulous about sunscreen for kids. To play devil's advocate, as I know we must do, and when patients come in to talk to us about products, prescriptions, procedures, they always want to know the potential side effects and the things also involved other than the benefits. And I know a lot of people are concerned about sunscreen and the chemicals involved. Is there a way around? Is there a way to protect from the sun without exposing yourself to harmful chemicals?
That's such a good question. I'm really glad that you brought this subject up because I think there's been a lot of coverage on social media and other media sources about this very topic. What we've discovered about sunscreen ingredients is that there are certain sunscreen ingredients that can be absorbed into your bloodstream. And we, as a category, refer to those as chemical sunscreen ingredients. So things like avobenzone, oxybenzone, octinoxate in the common sunscreen brands that you see at the grocery store, Neutrogena and Coppertone, et cetera. Um, Prior to, I'd say like 5 to 7 years ago, we kind of thought these ingredients sat on the top of our skin and weren't really absorbed. And if they were absorbed, that it wasn't of any significance. And then some studies were done that demonstrated that there was actually more absorption of those ingredients than previously thought. And those studies involved covering people with the proper amount of sunscreen, so really slathering them up, doing it every day for
Yeah.
weeks on end, and reapplying it every 2 hours. So, kind of practices that probably don't really translate into real life. But with that being said, we are wearing more sunscreen than we did probably 20 or 30 years ago. So, yes, these chemical sunscreens are being absorbed into the bloodstream. Does that mean anything? Is there any clinical significance to this? And the jury is still out, but I would say most dermatologists would kind of side on the erring on the side of it's not really of any significance. We haven't found any harmful effects. However, as a parent, that's going to come into mind, just like we don't want our kids to eat certain foods or put things on their skin. Maybe we're even particular about the fabrics that they use. So to get around that, I recommend sticking with mineral-based sunscreens. So those are sunscreens that have zinc oxide or titanium dioxide as the active ingredients. We know that those particular particles tend to sit more on the surface of the skin and have less likelihood for absorption. I wouldn't say zero, like zero chance of absorption, but less likelihood. They really act as kind of a shield or a coat of armor on our skin, deflecting those ultraviolet photons so that they don't penetrate the skin, as opposed to the chemical sunscreens, which are absorbed more into our skin and turn UV light energy into heat. So that's a very long-winded explanation. As a parent, as a teenager, if you are concerned about those sunscreen ingredients, look for products that specifically denote mineral sunscreen. And when you look at the ingredient label, look for that zinc oxide and titanium dioxide. Those have a long established safety profile. It's what I use for my own girls. And then you're just kind of eliminating any of that question in your mind. And I think we can all be more comfortable with that answer.
Yeah, I think it's so important to understand the data, understand what we know now. And we know as physicians that the data changes over time and we do the best with the information we have. But we know, and we've known for a really long time, that sunburns are very detrimental. And when I slather my children with sunscreen, especially when they're little, I always have a saying, because they always, as soon as you start doing it, they go, "Oh, it's disgusting. It's horrible." They have all sorts of things that they want to say. And I say, "I know, but you know what's worse than sunscreen?" And then they all say it at the same time: sunburn.
It's so true. And that brings up a good point is that the best sunscreen is the sunscreen that you want to use and your kids want to use. So whether that's a chemical sunscreen or a mineral sunscreen, a lot of the spray sunscreens are chemical sunscreens, but you are leaps and bounds ahead doing that versus not sunscreen because the sunburn is it ruins a vacation. You just feel awful, and it's just not worth it. So I'm
Yeah,
glad that your kids have picked up on that cue, and it's almost something that many individuals have to live and learn until they experience it. They don't really comprehend how awful those sunburns can be. But I, like you, experienced more than my fair share back in my youth, and I wish I could get a do-over on those years.
exactly. And we can teach those routines because so much in life, healthy habits, is simply based on the habit, on the routine. Speaking of routines, when it comes to skincare, we don't necessarily think so much about our skin health. We think about our routine, right? We're not necessarily focused on long term. What do I want from my skin? We're thinking, well, I saw this influencer, I saw this routine. It can be really, really overwhelming. What does a skin routine, a healthy skin routine, look like? How does that change over our lifetime? And are there things that we should be on the lookout for with our skin that let us know that we're not on the right track with our skin routine?
Yeah, good question. I always say skincare doesn't have to be complicated, but it does have to be consistent. Let's really streamline skincare routines because when it comes to products for our skin, more is not more, less is more. And more is actually often very irritating and harmful to our skin. It doesn't like that. Let's start with skin in our teens and tweens. Our skin barrier has not completely developed at that stage. So our skin is more sensitive. There's more, our barrier is allowing in microscopic particles. It's a little bit more likely to get inflamed or irritated. Our skin microbiome is really evolving. So all the bacteria and fungi, et cetera, that live on our skin are evolving. And then we've got all the hormones that are causing increased oil production and changes in that skin microbiome and changes in our skin barrier. So we're kind of in our teen and tween years in this like snow globe of chaos when it comes to our skin. And for girls and young women, that's going to fluctuate with their menstrual cycles. And for young boys, they're going to have more testosterone compared to girls, but girls also have testosterone. So we have all these things going on. And for our young people, the worst thing for them to do is then go watch an influencer who's doing a 10-step skincare routine, layering on all these products, and then they're replicating that at home on their very like young, naive, not fully developed skin, which is only going to exacerbate what they're trying to fix. So it's going to make the acne worse. It's going to make their skin sensitive and red and irritated, inflamed. So really working against their goal of having that gorgeous glowing skin that the influencer, creator, or celebrity demonstrated. So for our young people with a skincare routine, I whittle it down to the very bare basics. If they only want to do one product in the morning, a sunscreen, mineral-based sunscreen, because that's going to have moisturizing agents in it. They don't need to wash their face in the morning unless they've gone to work out, or if they have really oily skin, they may want to wash. But if it's just one thing, mineral-based sunscreen. And then Likewise, in the evening, they can keep it simple, super simple. Cleanser, because they've got to wash off all the dirt and sweat, oil, pollutants, everything their skin has come in contact with during the day. And then a moisturizer for their skin, because our skin relies on that overnight period to rest and repair and recover from the day. If it's not adequately moisturized, those processes are going to be so much more sluggish, and they're just not going to be as effective. So it is that simple for our young people. And I think really, for any of the parents that are listening, helping them understand that all those products that they might be getting at major beauty retailers that their kids are seeing on TikTok and Instagram and YouTube, it's our job as parents to put on those guardrails and guide them in the right direction with product selection. And that was one of the goals with Bright Girl Skincare when I created this line, to create a product that really resonated with young people, that was going to exceed their expectations, super elevated formulations that were benchmarked against the best, most premier dermatology brands I've tried over decades in this field. But adjusting those formulations so that they are age appropriate. They still have fun botanicals. You've got the aloe and the marshmallow root and chamomile and witch hazel, ashwagandha, turmeric. But those botanicals are very well proven, and we know their safety and efficacy in young skin. In fact, we also know the critical role that a proper skincare regimen and a consistent skincare regimen plays in fighting common conditions like acne and eczema and sensitive skin. So lots of studies coming out in the dermatology literature recently, demonstrating that simple routine of a skincare regimen that's consistent, cleanser, moisturizer, mineral-based sunscreen, has a tremendous impact on acne, even if you don't add anything else to that. So it's pretty exciting stuff. And also that we have evolved to understanding more about those formulations, how they need to work with the pH of our skin. So our skin pH is slightly acidic. A lot of traditional soaps were very alkaline, so they didn't play so nicely with our skin. Back when you and I were younger, we had the thinking of, we need to strip all the oil from our skin. We use these abrasive cleansers and exfoliating scrubs, polishes. We want our young people to stay away from any product like that, because it is so harsh and harmful to the skin at their age. Not to say that there's never a role for those things, but at their age, it really is going to do a lot more harm than good. So that is like kind of skincare at that age. And we can get more into, I can cover it now or later in the podcast, about what we need to think about as for the parents that are listening, like as we get into our 20s, 30s, 40s, 50s and beyond.
Yeah, I have a quick question before we do that, because again, our young listeners and young people on social media, they're following trends potentially more so than we are at our age, because we kind of know all the snake oil, right? We've figured that out. We understand that it's marketing. One of the things that's really popular right now that I'd love to hear your insight on are the makeup wipes. So the cleansers are great, but often you are going to need something to physically help you remove if you have thick makeup on. We've got plenty of kids that do, ballet or theater, and they have, makeup on their skin. So in those situations, when it was you and me, we would just have the washcloth, and hopefully it didn't smell bad.
We may have used it
like,
for a full week
like,
or more.
like, let's
Right.
get real. Let's get real. That was how it was back then. But now, a lot of young people are using these makeup wipes. They're made by a lot of those brands that you mentioned earlier, when you mentioned some brands that maybe don't always use the ingredients that you would really aim for as a dermatologist. So are you pro or con with regards to these wipes? And if it's a mixed bag, what's the best way to use them?
I would say I'm mostly pro. And here's the reason. I believe that many individuals, if they are wearing a lot of makeup, you're talking about concealer, foundation, powder, etc., for our young people that are performers or dancers, theater, etc., they need that extra step to remove the makeup. And It doesn't always have to be a wipe. Sometimes just a dedicated like makeup remover product, like a micellar water or a cleansing balm is a good first step, because the truth is like a gentle cleanser is probably just not going to do the trick. And it is more important to get that makeup off the skin. If it's sitting on the skin overnight, it's going to be irritating. Um, would I rather that they find a cleaner brand that's not packed with potentially irritating chemical ingredients? Yes. But I would say, kind of like the sunscreen, it's better to have that product than to not have it at all. And then in terms of brands, I mean, you really have to kind of deep dive into ingredients. There's not one particular one I recommend. I use the Neutrogena makeup remover myself because I love the way it feels. It gets my eye makeup off, and it's one of the few things that gets my long wearing lipstick off. And it doesn't irritate my skin. So that's what I use. Our daughters love the Clinique, what's it called? Take the Day Off Cleansing Balm, because you need a product that's actually going to bind to those makeup particles, which are usually more lipid based. So they're a little bit like kind of fattier and not as attracted to water. So if you're just using a more water based cleanser, it's just not going to do the trick, because that it's not going to mix with the makeup and take it off.
And that quick preteen, teen, wipe, 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 I'm done. That's probably not good enough either.
Not good enough. You always want to end your day with that adequate cleanser, with a proper pH balance, gentle cleanser. I mean, I use our Bright and Clean Bright Girl cleanser every night, because that is going to have what are called surfactants to kind of remove all that dirt and oil and any of that residual makeup off your skin. Our formulation also has skin conditioning agents in it that are going to kind of replenish your skin, support that skin barrier before your moisturizer goes on. So the wipe in and of itself is not nearly enough. It's probably better than just going to bed with all your makeup on. The ideal is to use the wipe or the makeup remover product. And maybe you're using that like right after your sports practice, and then you come home, shower, and do the proper cleanse. That's okay too. Like that's, you have to kind of do what works for the kids, and they're busy. But to your point with routines, if they can kind of habit stack these things and get into that consistent practice, they may find it's like easier than they originally thought to implement that.
Yeah. And it's a form of self-care, and it's not, it's not to the point of excess. When we talk about the skincare routine, that it's, 10 points and it's actually not necessarily helpful and it may be harmful. Or one, I think, people who love to get their nails done, hats off to them. That's wonderful. But it's fascinating to me how, as a doctor, how covering up smothering your nails has become a sign of self-care, because to me that's so counterintuitive. I do my nails with just at-home polish maybe 2 times, 3 times a year for, Christmas they'll be red, or, what have you, just for fun. But for general time, I like to let them breathe. I like to let them be free. And it's so fascinating how these cultural ideas become what we think of self-care, what we think of health, even though they're not that healthy. And I know I wasn't going to segue into this, but I think it would be an interesting thing to talk about nail health, because as a dermatologist, that is something that you specialize in as well. So how do you feel when you see, I even saw a social media clip the other day. Oh, it was very cringe. And a man was at a bar, and he was just doing, he was just going for the likes. That's fine. But he was saying how, oh, well, if I see that a woman doesn't have her nails done, that tells me she doesn't take care of herself. And it was so fascinating. And I think he also commented about her income. And it got spliced with with a female surgeon's routine, where she's like, in her scrub, she's looking at her nails and she's like, my income? Okay. Yeah. But It was really
So good.
interesting. It was so interesting, the public perception versus how we would feel as doctors. So what's your weigh in on the nail trends as they are
I'm
currently?
Yeah, I side with you on this, Dr. Shafer. I am a huge advocate of natural nails. My nails are not natural at this moment. This is my one of my 3 times a year, perhaps.
Exactly. Like
My
a few
nails,
times,
of course, like
Thanksgiving,
this
Christmas.
podcast. Touch me any time, and they're going to be natural. I really think so. I'm a big advocate of like being our best and healthiest and clearest self at baseline. And that is very much the case with skin health. So all of my patients that I see for skin damage or cosmetic, I always tell them like, my goal is for you to wake up with your skin radiant and glowing. So you never feel like you have to cover or camouflage or contour and change all these things with makeup routine. Like just wake up and go. And that's kind of how I live my life. And that is how I live my nail life too. And what I encourage with my daughters. And we see it all the time. So my daughters are ages 17, 14, and 11 now. And I cannot tell you, I would say my 14-year-old, at least 80% of her friends consistently have their nails done, and they're not just painted. I mean, they've got the
Right.
gel extension, like all these different like acrylates and ingredients.
Yeah.
And you're absolutely right. It's so when we look at like keratin in our skin, so think about our hair, our eyelashes, our nails that are comprised of keratin. The more we do to them, like the more we color our hair or highlight our hair, and I do highlight my hair, but it's going to be more damaging. Individuals, anyone who's listening who has had lash extensions, you know that in the short term it looks good, but in the long term it causes a lot of breakage and irritation and damage to your lashes. Our nails are the same. So when we are going and we're getting them, the polish drilled off and all that acetone, not to mention the polish itself and the ingredients, you're really kind of occluding that natural biologic keratin that's meant to protect your nails. So we're putting it through this all this trauma. We're pushing our cuticles around. We're getting stuff in there. Things are getting cut and trimmed. It's really amazing to me how our skin, our nails, our hair is like naturally like programmed to protect us and to just regenerate so that we shouldn't have to do any maintenance. But it has become maybe a bit of a status symbol unless you're the type of person like you and me that just embraces and really takes pride in our natural appearance and that we're not feeling like we need to do those things. I don't fault anyone. I think it's a personal preference, but from a health perspective, we do know that these consistent practices are damaging at some level. What will be interesting to follow, because this is the first time in history that we've been performing these nail practices consistently. So now we probably have like 10 to 15 years of data, but what happens when individuals do this for 20, 30, or 40 years? Probably, and the same with cell phones. Like we don't know what things will be like when we've been using cell phones for 60 years. Like, what health impact will that have? So
Right.
nail health, I will say, is the same. We don't yet know. Will we start seeing more skin cancers around the nail bed because of the lights that are used in some nail
Yeah.
salons? Will we start seeing like more nail diseases because of it? I think we're still too early in this journey to know for sure.
Right. We've already seen some products get pulled because of concern and at least acute or in the moment rather than chronic damage to nail beds and the surrounding skin. That happened maybe 5, 6 years ago with a pretty prominent product and it was pulled. So we certainly see that. And we also worry about infectious disease when it comes to salons. I, like you, I'm not here to shame anyone for their nail routine. That being said, I'm also here to say it's also really cool if you don't want to do your nails, that's also a cool thing. So don't worry about. And that guy at the bar, his opinion, it's not really what we care about. It's your health. So
Right.
good to just throw that out there. There are a bunch of cool ladies who, do their nails. There's a bunch of cool ladies and men who don't. Um,
Gotta embrace your own personal values and then just run with that. And that's going to be your right decision.
exactly, exactly. So you were talking about skincare for teens, and then we were thinking of transitioning into skincare for people of our age, below and a bit above. So what is a appropriate or ideal routine for someone like myself who is maybe on the I'm going to pretend I'm younger than I am. I'm starting to be thinking about the anti-aging component, but I'm not doing any procedures yet. What are things that I can do to optimize my skincare routine?
Well, so the really like unexciting answer, but the most effective thing to be putting on your skin every day is your sunscreen. So we're going to come back to that mineral-based sunscreen again every single day. Put it by your toothbrush in the morning because you're not going to forget to brush your teeth. So put your sunscreen on when you're getting ready for the day, or put it, in your like by the door that you always exit out of your house. So it's sitting there, you have it, stack it, and you don't miss it. Prevention is the name of the game. And that is where you're going to see your greatest gains. Now, what happens when the damage has already been done, as you mentioned, and as most of us in our generation are experiencing, um, retinoids are still the most clinically proven skincare ingredient topically. So these are things like tretinoin, adapalene, tazarotene, available by prescription, but also over the counter. Retinoids are much stronger than retinols, which are the majority of the over-the-counter products that you'll see. So anyone who's listening to this podcast will see retinol products. Retinaldehyde is an active ingredient that's not nearly as potent as the prescription strength, but we know that retinoids actually have the ability to repair DNA damage in our skin. They help increase that skin cell turnover. They actually help build and boost our collagen in our skin. So that's going to result in that more youthful appearance, helping fine lines and wrinkles, getting rid of also uneven pigmentation, which a lot of us experience just from chronic sun damage in our lifetime. So we can talk all about peptides, growth factors, exosomes, all these like new exciting ingredients. Sunscreen and retinoids are still far above and beyond the most effective compared to any of those other ingredients, but they've been around a long time. So it's not as exciting to talk about them. There is a lot of clinical evidence for peptides in terms of supporting collagen health, anti-inflammatory, et cetera. Not as strong as the retinoids, but if you have peptide containing products, that's good. Same with growth factors that are going to help with stimulating that collagen production. Not as effective as the retinoids again, but that is going to help. And now we're in this new era with an ingredient called exosomes, which are kind of the signaling molecules that help cells talk to one another. So this is like new and exciting technology, still not as effective as the retinoids. I'll keep coming back to that. But if you're looking to add in something that's a little bit more cutting edge, those exosomes are really kind of exciting, and I've tried them myself, and I like the results. And then the final thing is an antioxidant, and we have a lot of evidence about antioxidants. So these are things like the vitamin C, caffeine, cocoa, like ingredients like that. But I would say vitamin C serum is probably the most common. Those are really going to work to equip our skin to deal with all of the exciting things that come at it during the day. So the environmental pollutants, the stresses, the inflammatory factors, that antioxidant serum is going to kind of help layer in some protection along with our sunscreen. So those, I would say, kind of cover the bases. What do I use myself? I use a mineral-based sunscreen every morning, and I use a vitamin C slash antioxidant serum that's made by a company called Skin Better Science. It's called their Alto Serum. It's a mix of 19 different antioxidants. I love it. And then in the evening, I just use my Bright Girl products and then tretinoin cream, 0.1% every night. And, I have access to all those other things. That's still what I come back to. And a skincare regimen and consistency with that is such a big part of the equation when it comes to skin health in our 40s and 50s and beyond. We can bring in the lasers and chemical peels, microneedling when we need that extra boost or we're really needing to reverse some significant damage. But if we do that without implementing that skincare regimen, we're just never going to reach the potential benefits of those treatments.
Absolutely. And I think it's also important for people to understand there are the things that you are very aware of being a part of your skincare routine because you're literally putting them on your face or using them as part of your facial routine. Um, but there's so many other things that you do or don't do in your daily routine that affects how healthy your skin is, feels, and looks. What are some things that people can be mindful of just as they're going about their day and living their lives, ways that they can improve their skin health through their habits?
The number one thing is not during the day, it's at night, making sure that you get enough sleep. Sleep is so critical for all of our body's metabolic functions, but it's really critical for our skin. When we're sleep deprived, our body is in a chronic stress state, and that stress will manifest as inflammation throughout our body, and including inflammation in our skin. And inflammation in our skin is going to break down the collagen and elastic fibers. It's going to cause redness, irritation, blotchiness in our skin, dullness to the skin. So all the things that we don't want. So sleep is at the top of my list in terms of, even before diet and exercise and all those other factors, getting a good night's sleep is key. Diet is very important too when it comes to skin health, not as important as sleep, but very important. And we have a lot of studies in the dermatology literature demonstrating that a whole food based diet, so fruits, vegetables, proper proteins like the chicken, fish, ground beef, grass-fed ground beef, etc., can actually reverse aging in our skin. It's a very cool that we have clinical studies showing this, that individuals who may have had a diet that had more processed food in it, not all processed food, but more processed food, when they switch to that whole food based diet, their skin actually goes through reversal in terms of aging. And that also kind of circles back to inflammation. You're decreasing that inflammation, and then you're also providing your skin with all those structural components with the proteins and healthy fats. You're giving your body the fiber it needs, etc. So diet is really important. We know that exercise is also very beneficial for our skin in terms of increasing muscle tone and the support that that gives to our skin. Also with blood flow through our skin and kind of flushing out any of the toxins and helping circulation in our skin, exercise is really critical. So I would say like those are like the main pillars. So sleep, diet, exercise. I'll lump stress management in with sleep, but trying to avoid stress, which is easier said than done. When I tell my patients that, I'm like, no, you need to try to avoid stress. They're like, how, why? But anything that we can do in our daily routines to kind of mitigate that stress or get the support where we need it. And then, of course, our skincare habits and our skincare routines are important as well. But definitely those lifestyle factors have a tremendous impact. And you think about that practically, like how does your skin look when you're stressed and sleep deprived? You've been eating a lot of junk food versus maybe you're on vacation and you're well rested and you're eating like really good healthy foods and you're getting out and you're being active, and just the difference between those two.
Such good advice. So we've talked about prevention from the things we can do. We've discussed, okay, then as we are starting to learn how to take care of our skin in our teens, 20s, 30s, 40s, 50s, what can we do at those stages? something that's so important because we've had that exposure as kids. Most of us, unfortunately, hopefully the coming generations will have less, but we know we had it. So what is the regimen that you recommend to patients and listeners with regards to skin checks to catch anything, detect something that they need to go see their dermatologist to have taken care of or evaluated?
Yeah. So I recommend that every single person listening to this podcast check your skin over once a month or so. And that means standing in front of a mirror, maybe having a friend or family member check your back and the back of the legs, the areas that are more difficult for you to see, checking through your scalp. If you notice a sore on your skin that's been there for a couple of months and it hasn't healed, that can be a sign of skin cancer. Usually, if it's just an inflammatory spot, it will resolve within a couple of weeks. But something that's been there for a few months warrants getting checked. If you notice a mole or spot on your skin that's a whole lot darker than the other skin, so I call it the ugly duckling theory of looking at our moles. If you see that ugly duckling mole that's larger, darker, different, odd, it just kind of stands out from the others. It doesn't always mean that it's bad. It doesn't mean it's a skin cancer, but it should be checked by a dermatology professional. Um, and likewise, if you notice like a new spot that's been there for a few months and you're like, I didn't have that before, and that warrants going to see a dermatologist. I actually do not recommend that every person go and see a dermatologist for a skin check when you are still young and healthy, unless you have a family history of melanoma skin cancer or you have a history of skin cancer yourself. So the American Academy of Dermatology guidelines actually don't support somebody who's 32 and like super healthy and no other skincare, just going in for a check just because. But anyone who has a family history of melanoma in a first degree relative, so in a parent, sibling, or a child, should absolutely be checked at least once a year. Anybody who has a personal history of skin cancer should be checked at least once a year, and sometimes more frequently, depending on the frequency and types of skin cancers that you have. And then again, just monitoring your skin for those new and changing lesions or something that's persisted over time. Skin cancers often look like nothing at all. They are very sneaky. They might look like a little flesh colored bump. They might look like a pimple. They might look like a little patch of eczema. You're again, the clue and the key is when it's been there for a few months and it hasn't gone away, then it's time to get it checked. And again, doesn't always mean it's a skin cancer, but it warrants further investigation.
Yeah, you deserve to have things looked into. It's such a great perspective to absorb. And that's something that on this show, we really try to gift our audience because so many of us were raised with the thought of self abandonment and, oh, it's nothing. Oh, I don't have time for an appointment. It's fine. That can't happen to me. All sorts of things we tell ourselves. And the longer we kick the can down the road, the bigger the lesion gets, or even if it's not externally getting bigger, it might be getting deeper. And then that's when someone like yourself, as a Mohs surgeon, you have to go deeper. So get things checked out, see your dermatologist, see your primary care physician, make sure you're taking care of yourself in all aspects of your health. You are worth it.
Feel ashamed if you've had a spot that's been there for 3 years. Like, we've seen it all. I have patients that are embarrassed to say, or they feel a sense of
Mm.
shame. I've had this for so long and I haven't had it checked. Um,
Mm.
we don't think twice about it. Like, we're just there to care for you and take care of it at that time. Nobody's ever going to make you feel badly that you neglected it for a long time. But you're right, Dr. Shafer, the sooner the better. And we can only be our best selves and take care of everyone else around us when we're taking care of ourselves.
Exactly. And we only have today. That's all we have. Yesterday, tomorrow, none of it really exists.
Mhm.
We
right
have
now,
today.
this moment.
So
Yeah.
let's do what we can right now. And right now, I want to play a game with you. I've never done this before, but I'm excited. Interested to see if you'll play along with me. So without going into too many details, I want to play not too much thought because I know we're very analytical people. It's in our blood. We want to explain everything, but sometimes the most honest answers are just our gut first impression. So you as a dual board certified dermatologist, would you, when it comes to skincare, skip or get? And I'm going to list off some things and I just want your gut reaction.
Okay.
Korean face masks,
Skip.
facials. That's really broad, I know.
Get. Definitely get.
Get. Exfoliant like micro scrubs.
Oh, skip. So bad. So harmful.
Exactly. Salt, sugar scrubs, all those yummy
Yeah,
things.
coffee scrubs, polishes. No, 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 no.
Skip
Bad.
them.
Yeah, they tear your skin apart. No.
Chemical peels,
Get.
microdermabrasion,
Get.
laser treatments,
Get.
blue light therapy.
So if you need it, yes. But otherwise I would skip. Don't get it just because you want to. And I think you're referring to in-office blue light therapy, not like a blue light mask, right? Like an over-the-counter mask.
Yes. Yes. I'm talking about in office, but then we're going to talk about the
In
red
office,
face masks.
yeah, skip unless you have tremendous skin damage, sun damage, what we call actinic damage that your provider says, like, we've got to clear all this up with the blue light treatment, then it's good.
And what about those masks that are all over with the
Skip,
red light? Skip.
skip. They're just not effective enough. I think you can spend your money better elsewhere. There's too many variations in terms of the strength, how far away from your skin it needs to be, how long it needs to be on. Like, are you going to follow that? And then when you look at the clinical studies, it's not like super compelling data that it's going to be this game changer when it comes to your skin. You're much better off spending that money in office for a laser treatment, and you'll actually probably come out ahead.
Dermaplaning.
Get.
And this one's not for skin, it's for hair. Cold capping.
Get. If you need it, get.
Awesome. That was so much fun. Thank you for playing with me. I know as a
Yeah,
doctor, you want to be
I
like,
wanted
no,
to
let
go
me
into like,
explain why.
I can go into more depth with all of them. Like,
I know.
those are like the top of mind questions that like we always get like on social media, or we'll get emails on at Bright Girl, um, because that's what people are seeing, and they're like, well, should I spend my money on this? And they're seeing all these people talking about it. I really always circle back to data and clinical evidence when making any sort of recommendation, and then I combine that with my many years in clinical practice. Um, but there's a lot of hype over things that really are just best avoided and not necessary to spend your money on. But then there's also a lot of benefit for things like facials, with helping circulation of your skin and helping with congestion in your skin, etc., that people might view as like a luxury frou-frou experience, but I view it more as a component of your skin health. And on that note, I think a really important message is that self-care is health-care. When we do those things to care for ourselves, so maybe if you get the red light mask and it reduces your stress and you feel so good afterwards and you just feel like this is the ritual you love doing every day, go get the red light mask and you're caring for yourself. That's what's ultimately most important. Are you doing those rituals that make you feel good and relaxed and calm and fill your cup? And if so, that's a win.
I think that's such an important part. I think if you're doing it for self care and it's not harmful, then that's a win. I think it's also helpful to have experts like yourself say, listen, don't have FOMO, don't have fear of missing out. Because if you're not an expert, it's really easy to see these ads or these promotions and these Instagram influencers that are doing these routines, and you're thinking, oh my gosh, well, am I not investing in myself? Is this the sunscreen of 2025 or 2026? And that's where I think it's okay to take a pause and look at the data and talk to an expert like Dr. Angela Casey. Save your money, invest in the things that really have a positive influence on your mindset, your health, and your wellness. Is not detrimental to you, and save your money for maybe that well-known skincare routine that we just listed off, one of the ones that you said get, not skip, right? So save your money for the things
Exactly.
that we know
Or
work.
send yourself on a spa vacation and just save up all that money and go away for a long weekend. Just savor every moment of it. Funny that you mentioned that though, because we kind of have a running joke in our household about like my husband will ask me about like a new something that I implement into my life. Like usually it has to do with like supplements or like the way that like I'm eating certain foods or something. And he will say like, well, where did you like what why are you doing this? And I'll say like, I heard it on a podcast. Like because a lot of those podcasts are like expert driven. Like I listen to a lot of scientific podcasts, like
Yeah.
Dr. Peter Attia and Andrew Huberman and Joe Rogan. But then some of the ones I listen to are like a little bit more lifestyle based. But I think like it's important though that like we explore these things, look into them, but also then like trust the experts and let them guide you. As physicians, we certainly don't have all the answers. I think you said it well at the beginning of the episode. We have to always kind of question and improve and evolve in our thinking. And what we preached 15 years ago might be very different than what we're telling patients today, but that's all part of the process. And we have to respect that in our experts.
Exactly. We have to be willing to learn and grow. And we have to remember that as doctors, we have to remember that it's not all about knowing, it's about learning. And it's also about teaching. We're not here to tell you, do this. You know what I mean? Like, this is you buy this. No, we're here to teach you how to take care of yourself. The Latin root of the word doctor is to be a teacher. And that's what we're here doing. And that's why we do podcasts like this. And I'm so grateful that you have spent this time with us on the show, Dr. Casey, to teach us about health for our skin, proper skincare routines, and also keeping an eye out for things like skin cancers that can harm us so that we can try to intervene as soon as possible with the help of our doctors. Thank you so much.
I have loved every moment of this conversation. This has filled my cup this evening to be able to have this talk with you, to hopefully share some of the whys behind skin health and why we do what we do, and imparting that information and knowledge for your amazing community. So thank you for the opportunity.
Thank you, Dr. Casey. And everyone, you need to follow Dr. Angela Casey and Bright Girl. Learn about the products, learn about ways you can take care of your skin. She's got amazing social media presence to share so generously with you. Where can people follow you, Dr. Casey?
Absolutely. Follow us at Bright Girl Beauty, and it's spelled just like it sounds, BRIGHTGIRL Beauty, on Instagram and TikTok, and then on our website, www.brightgirl.com. And we have lots of informational blogs where you can dive a little bit more into some of these topics we discussed today. And then my personal Instagram is at Angela Casey MD. So we would love to see you. DM us, stay in touch. We love connecting with new community members.
Thank you so much, Dr. Casey. It has been wonderful and certainly filled our cup as well having you on the show. Thank you again.
Do you want to do a discount for your community, Dr. Shafer, on Bright Girl?
Storytellers, are we going to turn that down? I don't think so. Let's do it. We're not
let's
turning down a
let's
discount.
begin talking about routines and getting into new routines. Like, let's do a discount.
I love that idea. We'll have it linked under the show notes, and that way everyone knows where to find it and they can get their skincare routine, because I'm already ready over here. I know what I'm going to be taking off my studio makeup with tonight, because I love wearing makeup. I really love wearing makeup. But I also love taking care of my skin and taking it off at the end of the day. So, yeah,
And you
we'll
can
be
have it
doing that.
all. You can have it all.
You can have it all with great products and healthy choices. You can have it all. I want to thank you, storytellers, for being here on the show. We appreciate your time and would love to hear your takeaways from this week's show. Please share it with someone who would love this discussion too. And if you haven't already, subscribe to Talks with Dr. Shafer where you enjoy podcasts so that you don't miss any of the inspiring and informative episodes we have coming up. Until next time, stay safe and take care. I'll talk to you soon.